Our lead story tonight is about the curve. The one curve which the whole world is looking at very, very closely, about whether our country, and I want our producers to put that back on our screen right now, is able to flatten the curve. And why we're putting this on the Newstrack right at the top is because a lot of people seem to believe that the worst is behind them, that the virus has been defeated, that they've done their bit, the 40-day lockdown is now over and life can start resuming as it were earlier. This data set in our report tonight will show you why that is simply not the case. If you look at countries, now I'll explain to you what you're seeing over here. These are the number of days after a lockdown was announced, a national lockdown was announced. This is the number of new cases. It's a 7-day rolling average. We look at rolling averages because on any one day there can be a big up or down. For example, yesterday 2 states reported their data together, so looking at one day's data is dangerous. Therefore we look at a 7-day rolling average. What this data set primarily shows you is that in every other country where now lockdowns are being eased and life is returning to normal or the new normal, the curve was bent, quite literally. Italy, China, France in pink. In India, which is this blue line, the curve is still heading upwards, which means that the worst is far from over. We're in fact exiting the lockdown at a time when there are far more cases in Indian society, in our population, than there were when the lockdown was announced. And this curve is far from coming down. That's simply not happening. It's not skyrocketing like it did here. See, Spain, it skyrocketed. Italy, it skyrocketed like a hockey stick. That mercifully hasn't happened. But this curve can still at any moment head up unless we are very, very, very careful. Here's my lead story tonight.
$3,900 coronavirus cases reported in last 24 hours. India has recorded its biggest jump in daily new Covid-19 cases. As India takes small steps back to normalcy by easing restrictions, the numbers show that the fight against the virus is far from over. India Today's Data Intelligence Unit has found that there was no dip in new cases in the first 40 days of lockdown in India. Based on a 7-day rolling average, India added 2,022 new cases per day, and the number has been rising consistently. Compared to India, Italy, UK and Spain had a higher daily average of rising cases, but they are witnessing a downward trend. In fact, by the 40th day of their lockdown, France and China's daily cases were lower than India's.
India had actually, through the process of lockdown and through our containment efforts, had been ensuring that the cases do not increase. We are still following a similar trajectory. So when you will compare us with other parts of the world, you realize that their absolute number of cases would have probably little bit gone down, but India had maintained a similar trajectory of having lower number of cases. However, having said that, for us it is a day-to-day challenge.
The centre projects that India's coronavirus cases will see a drop by May 16th. But is that realistically possible? Confirmed Covid-19 cases in India have risen sharply, with active cases now growing at 6.4%, which means positive coronavirus cases are doubling every 11 days.
It is important to understand that we need to come to a level where day-to-day case increase should actually be not happening in a geometric progression. It should be happening, in such a manner where the number of cases do get added on a daily basis are lesser than that, and subsequently to a level where we can actually increase the doubling rate much higher so that case remains stable, and that is where we end up seeing a flattening of the curve.
The numbers are glaring. India's coronavirus cases are nearing 50,000. The question now is, when and how can India flatten the curve? With Nikhil Rampal, Bureau Report, India Today.
Now, what's of deep concern for India is that a lot of our cases are coming from our biggest cities. I want to show you the data that our data intelligence team has put together, which essentially makes the point that the vast majority of cases in India at this moment are coming from the major cities of our country, and that is of concern because 60% of the cases are from these 12 cities. Delhi, 4,900 odd cases, Jaipur, 1,000 plus cases, Ahmedabad, 3,300 cases, Agra, 620 cases, Kolkata, 660 cases, Bhopal, 560 cases, Indore, 1,611, Hyderabad, 591, Chennai, 1,729, Pune, 1,396, Mumbai, 9,123. Mumbai, the biggest, Delhi, the second biggest, Mumbai, double of Delhi. Now, this is the first data set because this is where population is most dense. The possibility of community spread is highest because people are so closely packed with each other. Let's come to the second thing I want viewers to look at. And remember, we're not being alarmist. We're not trying to spread panic, but we're trying to ensure that every person who is watching realizes that the worst is not behind us. In fact, it's more problematic now than it was when the lockdown started, which is why we need to be on guard. Take a look at this. 46,433 confirmed cases. The curve still heading upwards. Now remember, one of the things we've been saying in our coverage right from the beginning is that the challenge for India is to be able to flatten the curve. Far from being able to flatten it, the curve is still heading upwards. There have been 3,900 cases reported in the last 24 hours. This is the biggest single day jump in new cases. We have to be very mindful of such metrics. If we were being able to flatten the curve over a period of days, the number of cases going up actually starts coming down. Right now, that's not happening. I want to show you data set number 3 before I kickstart our conversation. This is what's happening in India. And if you look at, now can we come closer? Can we take this on the screen so that our viewers can see? If you look at this chart, the number of new daily cases is going up. So we're not in a zone where there's a peak that's hit, because why is it likely to happen in the same way in India? Because that's the way epidemics run globally. It goes up and then it starts coming down. In India, the number of cases, if you see this, the curve is going up. Now, we don't know where it's going. The challenge is to ensure it doesn't go too far up and it starts coming down, but it's not coming down right now. It's still going up, and that is what we need to be very, very mindful of. So, after having set the context, now let me introduce to you Dr. Shamika Ravi. She's a leading public health policy expert, working very closely with the powers that be to try and look at the data that's coming in this epidemic and trying to make sense of it. So, welcome. Dr. Ravi, I want to get started by asking you about the need for people to be vigilant. After being locked in for about 40 plus days, my sense is, and you tell me what you think, that people think, ab ho gaya. You know, we've done our bit, we've contributed to fighting the virus, now let's get back to work because it's just getting too much. Explain, why is that a problematic way of looking at the data? Why is it that we need to be more careful now than we were when the lockdown actually started? Dr. Ravi, welcome.
Thank you, Rahul. So first of all, I think what the lockdown has given us is clearly it has stemmed the increase, the very rapid increase that we have seen in most other countries. So relative to most other countries, we seem to have managed some kind of a linear, a growth rate which has been quite muted. What it has more importantly given us is time to prepare for this epidemic, for this pandemic, which means now at the district level, we have dedicated COVID facilities. The procurement of whether there were PPEs, masks, etc., that's still, everything is very much a work in progress. But what I know for sure is that the 40 days have given us a head start as far as managing this virus is concerned. That's very important. But clearly, talking about all India level stats is quite misleading, because the problem is not uniform everywhere. It has not been, never been, right from the beginning. But I think now we are at a mature sort of stage of this pandemic within the country. So it's very important to talk about exactly where is this exponentially growing and what are the states that do have this outbreak under relative control.
Okay, so let's deal with that, because the problem hasn't been uniform on a country basis anywhere in the world. In the United States as well, it was the East Coast, especially New York, that was most badly hit. There were parts of the country which later caught on, but New York took the brunt. Even in Italy, there was a split between North Italy and South Italy. In China, there was the Hubei province, which was most badly hit. At this moment, which are the areas you are most concerned about? Which, Dr. Ravi, are the areas you think we relatively have the situation under control?
Well, let's start by talking about states that are seeing a flattening of the curve. And by flattening, we are basically saying, you know, the active cases have declined or are declining and the recoveries are rising. That's the basic difference between, you know, you have to break up the overall number of cases into seeing where is recovery happening faster and where are active cases coming down.
No,
Kerala
so my understanding is that recovery is a lagging indicator. Now that people are recovering is great, but we have to look going into the future into lead indicators which give you a sense of where things are going. And there, if you look at the number of new cases that are coming, that curve seems to be going up. So yes, we are delighted that people are recovering, which is fantastic, but we have to look at whether the curve is heading up or is it coming down, and that's where I'm most concerned. What about you, Dr. Ravi?
Well, yes, the new cases, Rahul, are of great concern. So if you look at the 5-day moving average or the 7-day moving averages, which is a less noisy way to look at things, it is escalating, but not everywhere again. And that is where it becomes important to see that this is not happening accidentally. It's in places where you have higher recovery and lesser active cases are also the places where you are seeing the new cases coming up, which is lower in number. So, you know, we are seeing clearly Kerala, we are seeing Karnataka, we are seeing Jammu Kashmir, we are seeing Haryana, though Haryana is witnessing a second wave, but incredible recoveries there, right? Look at Rajasthan, Tamil Nadu is also having a second wave, but very good recovery rate there. Now, Delhi has been a cause of concern from the beginning because, you know, the numbers have been very large and in some sense the beginning of the outbreak. But they managed in the first few weeks pretty well. But what we are now seeing in the last 10 days is there is a big second wave. Now, the second wave should be an indicator of what is going wrong, Rahul. I think we have to stop talking statistics to people. And we have to start talking about what aspect of the strategy of containment where we are, you know, witnessing a gap because of which this infection is continuing to
So let me
spread.
ask you a direct question, because you're being guarded and careful in what you say. Which are the states or regions of the country that Dr. Ravi you're most concerned about right now, and why?
I'm most concerned about Maharashtra, and after that Gujarat, and then Delhi. And the reason I say Maharashtra, Rahul, is if you look at not just the new cases, which is also exponentially rising there, active cases overall are still continuing to increase in an exponential fashion in Maharashtra. Now, if you look at the active cases versus recovery, Gujarat is looking a little bit better, but still, they are also witnessing very large increases, but not exponential the way Maharashtra is doing.
Why is Maharashtra so messed up? What's going wrong there?
Frankly, and I think this is where we need now, you know, a lot more detail. We can't be now, let me be very clear here, that the level of information which we should be discussing has to be far more nuanced than just talking about overall national level or even state level cases and recoveries and active. We have to talk about what is the containment strategy in a city like Mumbai. What is the kind of contact tracing? How many people have been traced, right? What is the level of testing? Now, for instance, I mean, we follow testing at the state level very closely. Maharashtra and Tamil Nadu have carried out the same number of tests. I don't know anything about the contact tracing. They should make that information public as well. It reinforces confidence. But what you do know is that Tamil Nadu and Maharashtra have done very similar number of tests. And yet the cases in Maharashtra are almost four-folds of that of Tamil Nadu, which is telling you that, look, there is a reason why Maharashtra is still witnessing an exponential growth. Because that strategy of contact tracing, containment and testing is clearly failing.
No, but the government in Maharashtra can say, for example, Mumbai, many of the cases have come out of the Dharavi slums. They say, listen, be realistic. How do you contain anybody in a place like Dharavi, which already has people contained so close to each other?
Oh, but Rahul, that is such a silly argument. I'm sorry, I've heard that one too many times. You know, there are lots of public facilities in Maharashtra, in Mumbai. You have lots of stadiums, lots of public, large bodies, schools, colleges, stadiums. I mean, come on, it's a bit, it's silly to say that Dharavi should be in this kind of a crisis, sort of relegated to its misfortune and sorry, we can't do anything about it. if there is an outbreak, those people, the minute you say you do contact tracing and containment, meaning isolation, it cannot clearly be within those homes where the density is very high. And the hygiene conditions and the kind of mingling that you have, that is only going to spread.
Okay.
So,
I want to bring in a second perspective as well. Dr. Thun My Mahapatra joins us. He's an epidemiologist. I want to understand from you, Dr. Mahapatra, which are the colonies or the cities that you're most concerned about and why?
I'm very much concerned about Maharashtra, Delhi and Gujarat, but definitely I'm also concerned about cities like Calcutta and states like West Bengal and other states where we are not seeing that much cases right now, because we need to understand a few things. I completely agree with Dr. Ravi that it's not only the time to talk to people with only statistics. We actually have to think beyond that, and that is the strategy and other aspects. If we expected that lockdown is something like a magical, mystical way of bringing the curve down, we were actually on the wrong page. Lockdown is something which was actually destined to have three kinds of impact on the whole pandemic response. One of them definitely being the effort to break the chain and having the maximum kind of effort accumulated for not having the exponential growth in the curve. But it was also the time to buy time for getting better.
No, but can I then say, Dr. Ravi, that maybe some of that time wasn't fully utilized, because it's a bit of misfortune as well. We bought a lot of testing kits, rapid testing kits from China. They turned out to be defective. A lot of our time got spent thinking that that shipment will come, we'll be able to spread it out across states and then pump up testing. Now suddenly we don't have those kits. Time's been wasted. So in that sense, do you think that was time and opportunity lost? When we had the country locked down, we should have been getting the kits, and for reasons partly in our control and largely out of our control, that didn't happen.
See, Rahul, that will be like guesswork, right? It's speculation. And that's where I think we will never know, right? I mean, there are just so many things that could potentially go wrong. We have to really talk about details which I think local administration must make public. First of all, what is the role of Bombay police? I'm asking a very categorical question here, because if this entire decision, I mean, I want to understand, and I have been trying for the last almost 1 month to, because for almost now a month, we have been seeing this escalation happen in Mumbai, and more Mumbai than Delhi. Frankly, I think Delhi, though the numbers, active numbers are increasing, but it's nowhere close to, Bombay and Pune. We have to understand what is the exact containment strategy. What is the number of contact tracing done? Who is doing it? What is the role of civil administration, local police? I have not seen, I don't know what the order to Bombay police is, whether they are playing any part in the contact tracing itself. I have been saying this for a long time, that the one body within the local administration which has the manpower and the training to really carry out contact tracing through debriefing, call records, verification, the kind of details that are really required to manage and curtail this massive pandemic. So I think that's the kind of information which is
the problem which will show up maybe in about a fortnight from now is what we are seeing at liquor vents. Today was day 2 when liquor vents were open, and some states think it's a good way of raising revenue, so they've upped the taxes on the sale of liquor up to 70% because they're completely cash strapped. They want revenues, and therefore they've allowed these liquor vents to open. But there's a big mess at liquor vents wherever they open. Long queues, long meaning 1 kilometer long queues in different places, in Mumbai, in Delhi, and very little social distancing. Some people weren't wearing masks. The police had to come in and do a bit of a lathi charge, and this could start showing up because there are people coming out of their homes, going back to their homes, milling with so many other people. This could start showing up, which is why I've been making this point from the time I started the Newstrack tonight. We cannot afford to let our guard down. Take a look at this report.
लेकिन सोच बिल्कुल भी यहाँ पर पालन
Day 2 of Lockdown 3.0. More people are back on the roads as the country that stayed indoors for over 40 days looks to get back on its feet. The biggest crowds yet again were witnessed outside liquor stores in every city. From Delhi to Mumbai to Bengaluru. Hundreds waited for hours in serpentine queues to get their bottles. States, their coffers fast depleting, are also trying to raise revenues. In the national capital, the government has announced a 70% corona tax on liquor, ostensibly to keep crowds away, but that doesn't seem to have worked.
70% टैक्स बढ़ने का किसी को कोई गम नहीं है। ये एक देश के लिए हमारी तरफ से एक डोनेशन है, एक दान है।
इससे एक्चुअली में गवर्नमेंट को भी थोड़ा फायदा ही है। वैसे तो पब्लिक पैसा देगी नहीं, कम से कम इस माध्यम से गवर्नमेंट के पास कुछ अर्निंग होगी जिससे वो कोरोना की इस लड़ाई को लड़ने के लिए पैसा खर्च कर सकेगी।
Hardly 5 or 6 people are standing in the queue, but do not get confused as this line stretches for more than 5 kilometers. There is a small gate which has been made by police, and we go outside of this gate, and from this area till that point this line stretches for more than 2 kilometers. See, people have been standing in queues since morning. They have been waiting for their turn patiently. As you can see, there's very less distance between them. So social distance is very easily being compromised.
In a double whammy for Delhiites, the state government has increased diesel prices by 7.10 rupees per litre and 1.67 rupees per litre for petrol. In maximum city Mumbai, the Covid scare didn't stop people from throwing social distancing norms to the wind for their share of liquor.
People are buying huge quantity of liquor over here, but the most important part over here is that people are not following the social distancing norms. You can see Mumbai police officials also present over here. They are here continuously appealing to the people that they should follow the lockdown rules, the social distancing rules, but people are not listening at all.
In the south, Andhra Pradesh government has followed the Delhi model. It has hiked taxes on liquor by 75%. The crowds at liquor stores in cities have prompted some other states to do a rethink. The Tamil Nadu government has chosen not to open liquor stores in Chennai, citing the spike in Covid cases in the city. The fear now is, will the opening up undo the gains of the 40-day lockdown? With Devanshu Tomar and Saurabh Bhaktania, Bureau Report, India Today.
Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.